Hello, Namaskar, Sat Shri Akal, good afternoon everyone. This is Dr. Indranil Banerjee, a consultant endodontist, oral and dental surgeon practicing at Asansol, West Bengal. Thank you, Mrs. Sanchita Banerjee, for asking me to speak on oral health. Well, it's actually a huge topic and it's difficult to put everything together in a nutshell, yet I'll try my best. Just to start with, how should an ideal oral cavity look like? One should have strong teeth devoid of any caries or decay. And second is you should have healthy gums without any sort of loosened teeth or bleeding gums. A neutral breath you must have, and then, of course, you should have a tongue free of any sort of coating. To achieve all this is actually very simple. You just have to follow a few basic steps, and I'm sure if you do them correctly, regularly, religiously, I think you will be able to achieve the kind of oral health you want to have. The first and foremost, you must brush your teeth every day, twice at least. Sometimes I even tell my patients to brush thrice daily. That's not for everyone. Twice daily brushing, the first thing in the morning and the last thing in the evening before going to bed. You must brush your teeth with a fluoridated toothpaste. That is very important, and you should not be using toothpaste which are full of abrasives. Just for example, the ones which comes, that claims to whiten your teeth in just 2-3 days time. Those kind of toothpaste you should avoid. And then you must rinse your mouth whenever possible. If possible, after every meal, if it's possible, just rinse your mouth. Then the old technique of massaging your gums with your fingers after brushing, that is very important. And after brushing your teeth, try to use non-alcoholic mouthwash in a concentrated form. And sometimes you can stop doing that. In every alternate days you can just use your mouthwash after your brushing. And one more very important point is to floss your teeth every day. There are certain spaces in the surfaces of the tooth, especially the proximal areas where the bristles of your brush cannot reach. There, how do you clean them? So just to clean them, you have to use floss. There are so many flosses available in the market. You just pick any one of them and floss your teeth after every meal. That is very important. And then, of course, pay a visit to your dentist, if possible every 3 to 6 months. He or she will know exactly where a problem has started. And if it's in the reversible stage, a normal restoration, supposing you have a small cavity, an incipient cavity, so if it's that, generally it's a reversible state, the normal restoration can suffice. And if you just keep on neglecting that cavity, grows into a big one, then you have a swelling, pain, and it becomes irreversible, then you have to go for a root canal treatment, sometimes even extracting the particular tooth. And extraction is absolutely contraindicated nowadays, unless it is deemed necessary. You should not extract your teeth. And that's about it. And the most important point is, please do not neglect. There are so many things to talk about why you should not neglect the oral cavity. So that we'll do some other time. And I'm sure if you follow these simple steps, you will have healthy, happy, smiling face. So that's about it. Thank you so much for listening to me. Thanks. Bye-bye.